this is Dr. Shah with Weight Sense Lake Nona, and today I have Dr. Perez-Colon with us. She's a pediatric endocrinologist, and I'm going to let her introduce herself today.
Hi, Dr. Shah. Thank you for having me. Yes, I'm Dr. Chela Perez-Colon. I'm a pediatric endocrinologist. I am practicing currently in Puerto Rico, where I was born. I did my residency and my fellowship in New York City. I stayed there for a long time. Then I work in LA and in Miami. And then I'm back to my island because there's a lot of need of pediatric endocrinologists here. And I wanted to contribute to the medical system here.
I think that is so lovely. So, doctor, tell me a little bit about what you do day to day in relation to pediatric obesity.
In my clinic day to day, I see patients with the condition, right, of obesity. I usually teach the parents and their family about the condition. I first start making sure they understand this is not a characteristic, Dr. Shah. We usually see it and they'll describe it like it is just a physical characteristic, and it's not that. It's much more. So I educate them about the complications on obesity and I guide them through, not only to the patient itself, but to the family.
I love that. Part of the reason I wanted to have you on is I know from my work with adults that there is a genetic component of obesity. And that genetic component means that our children, so if we have extra weight, excess weight in our body and it's impacting our health, our children also are likely to display those same characteristics. So when people come to find me, they're worried not only about their health, but they're also worried about the health of their children as they're growing up. And they might be seeing, like you said, the changes in their bodies. And they're coming to see me. They really want to impart like the wisdom they get from the obesity teaching that I offer in the care to their children. But I always want to caution them because like children aren't mini adults. They have their own tools that are available to them. And most recently, we just had the new release of the American Pediatric Guidelines regarding obesity, which is like super exciting. And I just wanted to talk to you about those guidelines and regarding pediatric obesity.
Okay. So I love what you do. So important, right? For example, for children and adolescents to make sure they have a support at home, right? Like their parents also are taking control of their health. And it's important. They are definitely parents are role model. So whatever they do, their child tend to imitate that. That's where they learn from. Every time I educate about how to manage obesity, we need to include the parents, the guardians, whoever is taking care of the child at home. So in terms of the guideline, yes, we were all so excited about these new guidelines. However, many of the things that came in the guideline, we already knew. The new part is like now they're recommending the possibility, and in those children who have the characteristic and indication to start medications or even surgery, we could recommend it. But we always start with the basic, Dr. Shah. The basic is like we recommend like healthy lifestyle modifications, make sure the children are eating healthy and doing exercise, and then we monitor more closely. Actually, those guidelines were made to bring back the topic of childhood obesity table because we know it's an epidemic. As per CDC, over or more than 14 million children and adolescents have obesity, which is very alarming. Not because just we diagnosed with obesity, but it's because of the serial health consequence that obesity could have. Right? Just to mention few, I see patients as young as 10, 11, 12 years of age with prediabetes, with diabetes type 2, with liver conditions or fatty liver, with sleep apnea, with joint pains, with so many, with even depression. And all these are secondary to the obesity. So that's why we are so trying to tackle this problem right from the root. These guidelines are trying to, again, bring back the topic of obesity and give some guideline to general pediatricians and even to other professional, healthcare professionals to see how to address it. Because traditionally, previous guidelines that were published over 15 years ago, they're just saying, okay, you see the child in clinic, we do the BMI, we calculate it. And for those of you who are watching us and the parents, BMI stands for body mass index. In pediatric, we go by percentile. So every time the child or the adolescent come to the clinic, we do the weight and the height and we plot it in the growth chart. Any percentiles from 85% to 94%, we diagnose the patient with overweight. Any percentile of 95 and above, we diagnose the patient with obesity. And even recently, Dr. Shah, I'm sure you saw it, the CDC recently even extended that growth chart, those percentile, right? To include even more than 99 percentile, because unfortunately, our children are getting more with the condition of obesity and even severe obesity. So it's something that we wanted to bring back to the table and make sure we're doing what we're supposed to do.
And when if somebody's watching right now and they're noticing that the child's weight is increasing, there's something going on, but maybe they're not getting that. Maybe they don't know how to approach it with their pediatrician. What would you say? Like, how would you advise a parent to be an advocate for their child?
Okay, I love that question. We always need to advocate for our children, right? So don't be ashamed of that, right? That's the first thing we should know. Obesity is just a condition as many other conditions. The same way we go to the doctor because we have diabetes or we're not feeling well or the patient have a cough. If we're concerned about our child health due to the weight, yes, we should bring the patient to the doctor. And actually, something that I always recommend is to make sure that we keep our regular checkups, right? Not only if there's a concern, it's like the regular checkup with the pediatrician, which is the main doctor, right? The most common doctor the patient will see in pediatric. We're tracking that BMI. We're tracking that percentile in the crochet. And it's a time to catch up. If we see that BMI is increasing, we will do some intervention. And I'm not talking about medication. It's just like maybe bring that child instead of every year, every 2 months, every 3 months to check the weight to try to prevent when they come back in a year, it's not maybe too late.
Yeah. So my background's family medicine prior to being fully in obesity medicine. And when I would take care of my adolescent patients, my goal was just to prevent weight acceleration. So if they were able to maintain that weight because the child was still growing, that was a win. So I didn't actually recommend to weigh them at home and look for pounds lost. I would actually
Mm.
just recommend like improving their lifestyle and just stopping the gain because then that growth that the child is experiencing really helps us. Is that still recommended? And do you agree?
No, I do agree. I do agree. At least we want to make sure they are not gaining weight, they are stable. And we need to make sure we do it properly in a manner that they understand. We want to be careful also to be using maybe negative language and maybe at home to make sure we don't shame our children, for example. So when they come to the office, I usually say, we're monitoring your weight. We don't see anymore like an obese children, right? It's a children or an adolescent with obesity, with the condition. So there's many ways that we need to approach it. But yeah, I do seminar like you mentioned.
Yeah. And at home on the home front, I'm also a parent. I have young children and I see day to day, like how our children, how their behavior might be leading toward extra weight. So one of the most common things I'll see is just the promotion of eating sugary beverages or drinking sugary beverages, having food, not a food, I'll say having processed food items as snacks for celebration at birthday parties for every event. These things are seemingly innocent, but they're really harming our children. So could you speak a little bit about that?
Definitely, I agree with you. Right now, with the, for example, even with the technology, with the TV, we see so many commercials, for example, for fast food or unhealthy food that promote them, right, to eat unhealthy. So
Yeah.
that is definitely a factor that is influencing on the development of childhood obesity. In terms of, for example, rewarding, like you mentioned, for birthday and all that, when the child does something good, I say try to stay away for food rewarding. At least maybe just take them to the park or maybe take them to the library, give a book to read, but don't say, I'm going to take you for an ice cream or are some candies. There's some ways that we can change it. And we do understand children's are children, right? I wanted to experience everything. Yes, but it should be in moderation and we need to be on top of it.
And I'm going to add to that reward. I see that in adults too. For parents out there, I think when we as parents start to recognize that we were brought up thinking of food as reward, that's why we use food as celebration. Oh, I just got a job. Let me go celebrate with some dinner, drinks, and dessert. I deserve it. But I think that all of us can improve our well being by choosing like things, natural comfort to celebrate and enjoy ourselves. And then that's showing that modeling for our children that we don't necessarily need to have ice cream just because we got a good report card. We could celebrate by watching a movie, going to the park, just hanging out, playing board games, like some of these things that we used to do in the olden days. And let's be real, these marketing tactics and the food industry, they're like little gremlins. All they want to do is influence us everywhere because then we're going to pay money to buy their products and be addicted to something like sugar, which is super addicting. So, of course, our behavior will be modeled by that. So, I want to take the blame off of the individual, off of even the parents, and just really say and take shame out of it and say we can learn new techniques
Yeah.
and new ways to celebrate, new ways to reward. new ways to connect with each other and like actively grow into that as a whole family unit.
I totally agree. Right now, our brain does learn by continuous exposure. So we're exposed to that many times. That's what we look for. That's what we learn. Like you mentioned, this is a learning process and we learn that. So we pass it through generations. But we need to break that. Okay. There's other ways that we can do it in a healthy way. And Dr. Shah wanted to mention, for example, some recommendations for parents to help their children and actually they could implement it themselves is make sure that we monitor the portion control when we eat. I usually talk about that with my patients in clinic. Make sure that we decrease, like you mentioned, sugary beverage. At least I am Hispanic. And in the past, and even in my old family, I remember even my lovely grandmother saying, you need to drink orange juice. It has vitamin C. So there's so many things that we're trying to teach and to reverse that. So for us now, try to stay away of sugary drinks. Please offer water instead of soda or any kind of juice. You can offer the fruit itself. It has some natural sugar, which is healthier, right? That the concentrated ones. For vegetables, many children and adolescents don't like vegetables. And even some adults, we say, okay, it's not that we love it, but we know it's healthy. And we need to try to encourage that to our children. So what I do usually recommend is make it fun. Go maybe to the grocery store together. Let the child or the adolescent go to that vegetable aisle and let them choose something that they like. That most likely end up with the willingness of them to try it at home or look some recipes the night before with them. Sit down. What do they like? Go and do it. It needs to be fun and it needs to be in family. Nowadays, we need the family to be together for many reasons. And one of them is to be healthy.
Yeah. And I think when we're making it fun and when we're talking about growing and getting together as a family to make this something for all, I definitely want to say don't make it punishing. Like when we make it exciting and it's just more engaging. And it doesn't have to be that like the child or the parent has to eat everything on the plate or force it. But if they are curious about the vegetable in the grocery aisle, it's great. Like, what is this vegetable? I don't know. But if you want to figure out how to cook it together, we certainly can. That gets them in the kitchen. That gets the children like exploring real foods with you. And we live in 2023 where there's so many cooking videos, there's so many shows, so many ways to learn. If we just get ourselves to try one new skill, just one new skill once a month, or like repeatedly once a month, you'll surprise yourself at like how much you can grow.
Yeah.
Another thing, I think we share a little bit of the same type of upbringing. In my family, it was you must eat in India like Parle G biscuits and glucose biscuits, literally sugar biscuits. That's how you start your day. And you want to have orange juice again for the vitamins. But we live in a different world now. That glucose is available everywhere. So we don't need it. But the other thing that I think that comes from us as parents that we may have been raised with is like the clean plate club. So you mentioned portions. And so a lot of my adult patients battle with having to feel the need to finish up their plate because you could not waste food. And unknowingly, we might push our children to do the same and overstuff themselves. Versus if we support our child with like healthier food options, foods that are going to naturally keep their hunger signals in check without shoving food, like saying you have to finish all of this, it's also beneficial.
Agree 100%. We don't need to do that. Just put in the plate a reasonable portion, right? Not too much, not too little. And that's it. They should finish that one, not big one. And they shouldn't complete it if they don't want to. I agree. I
Exactly.
had the same experience growing up, but
Yeah.
that has changed. And we're trying to change together. Also, even though we're doctor, we're also implementing. I implement all these changes at home. I have a daughter and it's the same. And it's a working process at clinic, but also at home. So we're
Exactly.
close. So
Yeah, and I definitely think that as we grow together, something you started at the beginning was modeling great behavior. So I think this is so fantastic. Like I myself as a person have changed through my life in regards to like my approach with food. And I think that's why I love obesity medicine so much. But now I take those things that I've learned and I try to incorporate it with my children. I still have picky eaters. I still have battles as well. It's not always perfect. There are days where I too am ashamed of what my kids might be eating. But then they're always learning and they're learning from the way I'm approaching my life. So like movement and physical activity has been a really big thing recently for me. The weather's changing. We're lucky we're in like tropical climates, both of us. So now I think with 2020, 2021, maybe a lot of us were more inside, like COVID scared, and we may have lost connection with the outside world and being outside and going to parks. There was some fear with being close to people. I think we can get back to being like active again outside in nature and connecting. So do you have any tips on like how to bring physical activity into the family?
I usually also say it to make it fun, right? And we should be doing it as a family. Also, sometimes I hear it in clinic from patients, oh, I can't join the gym or I can't for different reason. That's not an excuse. We can do activity. We don't need the gym if we don't have the opportunity to go. We can do it at home. We can go up and down the stairs. You can go to the backyard. If you want to do it, you will be able to do it. So we recommend, right, for pediatrics, usually 60 days of physical activity, 60 minutes per day of physical activity, right? 1 hour per day. But you don't need to do it all at the same time. I do understand our kids' schedule, it's very busy. An hour as a parent schedule is busy. So maybe if we arrive late from the school or the after school activity, we can do 20 minutes of activity now. Then we can sit down, do the homework, and do another 20 minutes. So you can break it down in session, but we need to do it and make it fun. I always in clinic ask the patient, what do you like to do? Do you enjoy dancing? Which type of music do you like? Or what do you, basketball, why? Do motivational intervention and taking history. So then I, as a doctor, I can apply it and make it individualized for every single patient. And always including parents. That's like you mentioned before, is a way to connect. We need more connection than ever within family member, and that's an awesome way to do it. And even though at the beginning, the adolescent may say, oh, I don't want to do it with mom, with that. No, trust me, when they come back, when it's 60 minutes and maybe you were at the park or you were walking, they enjoy that. They really do.
It is that drag, like that initial drag and like motivation to go and do it. I'll face my kids like, hey, let's go for a bike ride. I'm like, oh, I just want to play. I just want to play on my iPad. And I was like, no, we got to go do it. It's a great day outside. Let's go. One trick I have, and this is with like, because you mentioned dancing and stuff, is sometimes we just have to be silly. And often, even if I'm not in the mood, if I start doing the action, like the physical action will change the way I feel. So if I know I'm gonna like my daughters are like in a bad mood, or maybe they could use some physical activity, I just turn the music on and just start acting goofy, start dancing with them, we're just gonna change too. And if I just start getting them to like go outside and ride their bike with me, or if I make it about me and not even them, like, hey, mommy has this goal, like go outside and ride her bike, then they actually feel like they're helping me. They'll do that. And another little tidbit is even with studying, I find physical activity and movement while we're studying, like kind of how we used to do when we were kids, right? Like we throw the ball back and forth to learn things. So I kind of transition myself back. Like, what did I do when I was a kid before all these tablets, before all these screens and TVs and so forth? I used to take a ball and throw it. And I feel like I'm so Jerry, like so old when I say this. Back in my day, this is what I did.
We're the same. Too.
Ball, help them learn, toss it back and forth, connect. We're only going to be in this phase with our kids for so long. And the things that you teach them, the things that you model, it's not going to be this just the scholastic stuff. It's like how we do life. And even if you're struggling in this area as a parent, we can take our struggles, we can take little nuggets and still teach it to our kids. And we can do this together. And I guarantee you, you're going to be successful and we're going to turn this ship around.
Definitely. I agree with you. And just to make sure that for the physical activity is 1 hour per day, 60 minutes per day. But I love what you mentioned about the playing and the studying. We should find fun ways and individual ways, right? Not what fit maybe for one family would fit the other, right?
Yeah.
To think outside the box and make it fun.
Yeah.
I also look for support. I always say, like, many parents and even myself, I'm like, I know everything. I'm a doctor, I should know. And some, you always learn. We're always on a learning process. Things are changing. So get support. Go to your doctor, make sure, meet with them, see if you will benefit maybe from a dietitian and a nutrition consult. So don't be afraid. Look for help. And we're here for you.
Yeah, and I'm gonna add to that where there are so many levels of support. So if we really look at obesity as a disease, the reason it is increasing, the prevalence is increasing in our society right now is because of genetics with our modern biology or with the modern world. And that world is being influenced by marketing, by medications, by our sedentary behaviors. Like literally everywhere, there is something that is promoting us to gain weight. So if we want to combat that, like for what it is, we have to grow. We have to have tools in place to support us. We have to really put our thinking caps on and say, if I see myself as being a family that moves, how am I going to do it? If I see myself as a family that's going to eat fruits and vegetables, how are we going to do it? How are we going to help this so that it's easier for our children?
Yeah.
And better for ourselves.
Agree. Agree. I always say small changes are good.
Exactly.
That's important. It's not like you need to do all of these the same day at the same time because it could be overwhelming.
Yeah.
Just something and do small changes. Let's see, this week I'm going to try maybe just a vegetable. And then next week I'm going to add another vegetable, or maybe I'm going to add the physical activity. But starting is always good, right? And small changes, those are good too.
Yeah, I love this conversation. So doctor, how can people work with you? If they have a child that needs endocrine support, how can someone find you?
So my practice is called Elite Endocrine MD. I'm located currently physically in Puerto Rico in the area of San Juan and Dorado. However, I do still have my license from Florida. I worked there for so many times, and many of my patients still would like to see me even virtually. So that's why I kept the license. And in Instagram, we are in social media. We know that we need to educate. As doctor, we need to come out, educate the community, right, in a good way to make sure we're sharing the knowledge that is correct. So my Instagram profile, it's like Elite Endocrine MD underscore Dr. Perez. Maybe we can write it later, but that's the way that you can connect with me.
Fantastic. And then if there's a patient in Florida, could they still work with you virtually?
So right now I'm arranging that because like, I do have the Florida license. At first, I'm like, no, I'm going to stay only in Puerto Rico. But many of my patients has been writing to me that they would like to do it even virtually. So very soon that will be an option.
I think that is fantastic. So thank you so much for joining us. Is there anything else you want to share?
No, thank you, Dr. Shah, for having me. This is so important conversation. I'm so happy that you're so into adult obesity, right? That you see
Sure.
patients with obesity as well is something that we need to keep working on. And one more tip for parents. We spoke about healthy lifestyle, right? Eating healthy, doing physical activity, limit the screen time, but sleep is very important. Most of the time we forget about sleep pattern, and sleep, if we have poor night sleep or pattern, that will make some changes in our body of the hormone that can predispose to obesity. That's something that is proven. So make sure your child, your adolescent sleep at least 10 to 11 hours per night. Let's take off maybe the screen, the iPad or the iPhone before they go to sleep so they can sleep well.
And I always tell that to my patients to protect your sleep. Like before we get to anything, if you are a sleepy person, you're going to go through life tired, and I need you to sleep better so that you can make the changes you need to improve your life. And the other little tidbit I'll add, because you're saying it, is just know that you have every opportunity to get healthier, to grow, and it's really mindset. So once you believe it in yourself that it's available to you, you can do it. That's
I
it. You can do it.
I agree. It's never too late. At least if you're thinking about it, let's just start. Don't regret what you haven't done. There's a lot of room for improvement. And Dr. Shah, one more thing for those who are watching, my website also is another way to connect. It's www.eliteendocrinemd.com. There's more
Awesome.
information.
Thank you so much. I hope we can do this again soon.
Yes, I love it. Thank you for so much for the invitation.
Yes.